the reality is that we must, as a nation, stop apologizing for bad behavior. I mean, whenever somebody commits a crime, they need to pay the price and go to jail. There should be a difference. I mean, this is not really white collar. Putting our children in generational theft of our children through government sanctioned, if you will, because when people commit fraud and the government doesn't take action and people are not prosecuted, it's really sanctioning generational theft. So I really do believe that when someone is caught, they need to be prosecuted to the fullest extent of the law and dealt with and put in jail. Doctors that are participating, doctors that are running businesses that are caught bilking Medicare and Medicaid, they should lose their licenses to practice medicine. They shouldn't get a slap on the wrist. So we must do this. We must take responsibility to stop fraud. Very simple.
Harrington, 1 minute. What is your position on cracking down on Medicare, Medicaid fraud, which is driving those programs toward bankruptcy?
Well, Donnie put it pretty eloquently, cracking down on the fraud. I think we should make the punishment more aggressive. You know, obviously, Robert's in the healthcare business, and he must know a little bit about what fraud is in his company. But in the restaurant business, it's something that I personally deal with. So when it comes to cracking down on the fraud, obviously it comes down to the fact that the United States government cannot manage our health care. And the bureaucracy involved in trying to keep track of it is something that the government should not be in control of. We have to find ways, yes, to crack down and punish those responsible and make the laws tougher, as Donna said. Thank you.
I'll give everybody an extra 15 minutes.
Thank you. It was pushed towards Robert because he's in the industry in which actually deals with the paperwork and the handling of such paperwork. I don't do that. It was simply pointed out to Robert because he has experience in assisted living facilities and is used to seeing that kind of paperwork, and he would have more knowledge as to how to handle that.
Then I accept that.
Mr. Lowry, you have 1 minute and 15 seconds.
I believe Karen was simply pointing out that I am in the healthcare business and not insinuating that my business is fraudulent in nature. And I appreciate that. Yeah, well, we're all up here doing the same fight, aren't we? Listen, fraud. When I read The Economist, and New York State had a deficit of about $15 billion last year, and then I read one of my healthcare periodicals, and they said New York State also had $15 billion in fraud. So it's very important. If they could just balance the budget, we do away with the fraud. The reason you have fraud is because you have a government, I have to be careful so I don't lose the government vote, but you have government employees that don't care. You see, it's mechanized, and you're right, Karen, I do deal with this, dealing with Medicare, but the state of Florida was smart. What they did is privatize the system. What they did is they put a private company in charge, so the state's only on the hook for what they're supposed to be on the hook for, and not the fraud, and they police the action. So if we privatize Medicare and Medicaid, much like they do assisted living in this state, Florida, I, as your representative, would push that we hire Dog the Bounty Hunter. Have you ever seen him? If you give him 10% of $15 billion in New York, I promise you there's not going to be any fraud in New York City. What we need to do as Americans is take America back. I want my government back, and that's why I'm here tonight. That's why you're here tonight. We got to stop messing around with the political correctness. And while the government gets the only entity that can do it well, we can do it better.
15 seconds.
Bring on the dog.
15 seconds as a wrap up because I gave them each extra 15. If you want to say anything. It is fair because they each got 15 seconds more, so I don't want to do that.
Throw the criminals in jail. That's it.
Okay. Now everybody's got an extra 15. The last question in healthcare. What is our game plan on what conservatives can offer to make American healthcare better? From Terrence. And this goes to 2 minutes to Ms. Harrington.
Well, Paul Ryan, the congressman, has a great plan under the Republican ticket. And like I said in the last question, it can start with a few simple things. And tort reform doesn't necessarily have to be addressed at a federal level. Texas has taken on one of the strongest tort reforms in the country. And we as Florida are becoming a haven for attorneys to come here because we don't have the limits in the tort reform the way Texas does. So also, as we talked about in the last question as well, is people being able to take their insurance with them. You and I buy car insurance, we buy cell phones. These companies compete across state lines nationwide. Competition drives down the price, and it makes it more competitive, and it lets the free market flow and everybody be profitable in it. And also is, like I said, the ability to take your insurance with you. We shouldn't be limited as to where we can have our health insurance and where we can take it. And also they're looking at several ways to take Medicare and to reform that as well and to limit what's happening in Medicaid. But our health insurance is our most important thing to us on our level, and on our personal level, and the government is trying to take it away. And I can tell you as a cancer survivor and the mother of a cancer survivor, my health care is very important to me, as I'm sure it is to many of you. I do not want someone telling me when I can go to a doctor, how I can go to a doctor, when I'm too old to go there. That relationship should be between me and my insurance company. And we should be able to have the competition of these companies so we can drive down the price in the private sector. I do not want the government interfering in my ultimate personal choices. And I don't want to have to put my family at risk, perhaps by the government creating a bigger system, which I will, perhaps we didn't get to the doctor in time in order to save our lives. Thank you.
What is our game plan on what conservatives can offer to make American health care better?
There's 5 simple solutions to health care for a very complex problem. One, you have to start with meaningful tort reform, as we discussed. You really have to take defensive medicine out of the equation. You have to stop incentivizing doctors to give every kind of test just to cover themselves. When an indigent walks into the Aventura Hospital pregnant, 9 times out of 10 will give her a C-section instead of a vaginal birth, because not only is it 5 times more expensive, it's 100 times less litigious. So we have a lot of fraud in our system too. You have to make it interstate. You have to be able to carry our insurance across state lines. 3, you have to reduce government mandates. In all of our programs in Florida, I pay for breast cancer awareness and Karen pays for prostate. I don't think she's going to use hers, I'm not going to use mine. Let's buy what we need. 4, eliminate the cost shifting between the federal government and the private sector, which is the doctor's not getting remunerated in Medicare, so he just raises more costs to the guy that's paying private pay or through group insurance. That's us. 5, what we need to equalize the tax burden on either your individual insurance or your group plan. Equalize it. Either start taxing the group plans or eliminating the tax on the individual plan. Then you'll have more competition.
What is our game plan on what conservatives can offer to make American health care better?
Well, in one minute, you really have to say is more privatization. You have to get the government out of the relationship, again, between you and your physician and you and your insurance company. We really have to get back to the way it was before when we had our relationships with our physicians. Tort reform is also very, very important. You have to allow the interstate commerce. Insurance companies from all over the country should be allowed to compete in every state of the country. We must allow that. So, and that's only going to happen through less regulation, getting the government out of the healthcare industry and out of the insurance industry.
The last topic, immigration. The first question will go to Ms. Donna Milo, and will be 2 minutes. What is our strategy on strengthening border security and stopping the illegal alien problem? How can we let Americans know that this is going to cost Americans without projecting racism? Hard to read. You can. Let me try to rephrase it again. Yeah, it's hard to read. What is our strategy on strengthening border security and stopping the illegal alien problem? Let's just stick with the first part. Ms. Milo, 2 minutes.
Well, we're a country of laws, and we have immigration laws, and we have borders that need to be secured. Our government needs to take whatever measures necessary to secure our borders. It's part of the government's few responsibilities